Welcome everyone to the PFCC Partners May workshop. I'm really excited about our topic today. We are going to be doing a year in review and a mental health check-in, and we'll be joined by Naomi Williams, who is the Patient and Family Support Coordinator at Augusta University Medical Center, and Libby Hoy, who is founder and CEO of PFCC Partners. I myself am Lindsay Galley, Director of Education for PFCC Partners, and will be kicking off our session today. So for those of you who are new to Zoom, I am hoping that you are able to see my screen. On your screen, we have a lot of buttons that you can use to really use Zoom to the best of your abilities. There is the mute button, so if you have some background noise, please mute yourself. I can also mute it for you if I hear anything strange happening. And then we'd love to see your smiling faces, so please feel free to turn your cameras on if you feel comfortable sharing your video as well. And we also have the chat. If you have questions throughout today's presentation, please feel free to put them in the chat, and we'll have a little bit of time at the end of the session to get to those questions. We got a lot of great questions within the registration, so thank you so much for submitting those there as well. And then if you have any questions about using Zoom, please put them in the chat and I will help work with you to troubleshoot. Really quickly, before we get to the presentation, I wanted to introduce our organization, PFCC Partners, for those of you who are new here. PFCC Partners is a patient-driven organization. We all serve in the role of patient-family partner, anywhere from our local hospitals to national partnerships. And we really utilize our experiences as partners in healthcare to support the partnerships of healthcare providers and patients and families, because we know that the best possible outcomes happen there. We have a tiny little vision, just kidding, it's huge, to reinvent the healthcare industry so that hospitals and healthcare organizations and all stakeholders can continuously partner with empowered patients and families as a resource in the co-design of programs, policies, and quality improvement activities. And we do that again by using our lived experiences as patient and family partners and the experiences of those that we partner with in the PFA network, which I'll talk about in just a moment, to develop strategies and programs and content and resources that, one, support the patient and family centered care structure and culture for healthcare organizations, and support other patient family advisors to partner with those healthcare organizations effectively. And the PFA network is one of the ways that we do that. The PFA network is a ever-growing community of patient-family advisors, all using their lived experiences to influence healthcare improvement. Right now, the network is, I think, over 800 strong, all partnering across the country nationally to really bring the patient and family perspective to all of the changes and improvements that are being made in healthcare. We have monthly opportunities to come together and build community and meet one another from across the country, meet other patient-family advisors doing really incredible work all across to understand their experience as well. We also offer skills exchange opportunities to build your skills in partnership with healthcare, and have an ever-growing list of engagement opportunities that we share with patient-family advisors who are part of the network as well. So I'll put a few links in the chat as I pass it off to our presenters today if you are interested in joining the PFA network. And then I'll also put the link to our June workshop registration in the chat as well. We will be joined by Gabrielle Gussin, who is a research coordinator and graduate student from the University of California in Irvine. And the topic for next month is Better Together, Collaborative Approaches to Prevent Nursing Home Infections. This presentation will talk about infection prevention collaborative projects in Orange County nursing homes, which were led by UC Irvine with the support from local public health. They will highlight the Orange County Nursing Home COVID-19 prevention team and their SHIELD Orange County program as well. So I'll put a few links in the chat as we get started. And again, if you have any questions, please put them in the chat. And with that, I am very excited to introduce our presenters, Libby Hoy, again, who is the founder and CEO of PFCC Partners, and Naomi Williams, who is the Patient Family Engagement Coordinator for Augusta University Medical Center. And Libby, I think you are going to take it away.
Great. Thank you so much, and welcome to everybody. Thank you so much for taking time on your Friday afternoon, Memorial Day weekend to really dive into this year in review. I'm very much excited to share our thoughts with you and hear from you as well. I invite any of you to turn on your cameras. We really love to be part of this community together. So I see some very friendly faces and new faces and new names as well. So with that, Naomi, do you want to start us off? And you're on mute, Naomi. I think we want to go to the next slide, Lindsay, and come back. I'm sorry, I neglected to get my order correct.
Yes, thank you. So I am outside, so you might hear the birds with me. I am Naomi Williams. I'm so happy to be here with you all today. If you will, let me get my clock. I invite you to just take a breath with me. We're gonna take 10 seconds. That's it. I have a timer. I invite you to close your eyes and just take 10 seconds of self-care for you. So we are going to start now. Okay, I invite you to open your eyes again. It was 10 seconds. Hopefully we've been able to exhale. So we have a nice review coming through, and if at any time you need to just take 10 seconds to breathe, please do. So Lindsay, if you'll go back to the next slide, and I'll turn it back over to Libby. You're on mute, Libby.
That's the quote of the year.
We will get through this. We will get through this. All right, so we have a little bit of a poll for you today, and I want people to just invite you to chat into the chat box. Did you run out of toilet paper in 2021? Oh, we have the poll live.
Yeah, we actually have the poll.
Should have known. Did you run out of toilet paper in 2020? There was a great fear of running out of toilet paper. Oh, I didn't submit. Look at those shelves, cleaned out. That's what my grocery stores look like. I don't know about yours. Yeah. Oh, somebody did. Darn. Well, I think, you know, this is really kind of a silly question to get you kind of thinking, and we've had that deep breath, and now we've kind of have this thought in our mind that's a little bit light. It's a little bit easy, gentle, feels good. That's mental health, right? That's that moment of ease. And I think 2020 really challenged every human on the face of the earth in terms of keeping that sense of peace and inner just calm. And so we wanted to really reflect on that today and what we've learned. And for me, it's just been such a unifying human experience that we've all been under this duress in this last year. Certainly many more than others, but no one has really escaped feeling some sort of burden from the previous year's events. And so we're gonna just take a moment for Naomi to walk us through some of those challenges before we kind of move into one of the strategies we used at PFCC Partners to help us navigate this time. So Naomi?
Thank you, Libby. I put in the chat, and I see a couple, somebody said they purchased the bidet just in case, which is great. I learned that I was a toilet paper snob, as are others, bartering for their favorite type of toilet paper. So Libby, you set it up so well. So let's think back to January 2020. What I remember most coming into 2020 was what happened in losing 9 amazing people in January. Most people say Kobe Bryant, his daughter, and 7 others. I like to look at them all 9. Before I go into that, let me just say May is National Mental Health Awareness Month, and that's part of the reason why we are doing this and focusing here, and I work to connect the dots. The objectives today are for you to be able to do a mental health check-in with yourself. How are you? Number 1. Number 2, what can you take and pass on to someone else? What can you give them as a practice? And then number 3, being able to experience life through somebody else's eyes. So it may not be your experience, but it's still an experience nonetheless. And knowing how our experiences impact our mental health. Okay. And so for a lot of people in January, when Kobe Bryant died, it was massive. It was amazing. People who never met him were in tears. Not to mention the other John, Carrie, Alyssa, Sarah, Peyton, Ara, and Christina. I think it's important to mention people's names, how they were impacted, their families and their loved ones were impacted as well. If we only knew what was to come. Lindsay, if you go to the next one. So that's how January started. So looking at mental health and how we get impacted in various ways. So we're going to look at through events, media, and personal. 2020 hit us. If you think in the very beginning, we're talking about, this is an election year, so you have the Democratic convention stuff going on, or the nominees. We come up into March, we have the coronavirus, people out there fighting for toilet paper and chicken and whatever else. If you go to the next slide, we have getting tested, we have Ahmaud Arbery, we have Breonna Taylor, we have these different things that are going on and hitting us. Even beyond 2020, even looking now into 2021, the events that are still happening, we've had several mass shootings. You can look at the picture in the middle is dealing with the Texas power outage. I don't know if anybody here was affected by that. I live in Georgia. That didn't directly impact me, but I know the people who live there and how that impacted them. We have vaccinations that are now out and available. Is it going to happen? We have the Super Bowl, so we're coming back. The world is opening up again. So how do all of these different events play on our mental health? If you go to the next one. So you have events that are happening, and these are ones that are just out in the media mainstream, if you will, not knowing what's going on in your local area. Then you have the media that pulls into and how it affects our mental health. What are you seeing? What are you hearing? We have the debates. We're seeing PPE. There's a shortage on hand sanitizer. People are reusing things that protect them that should be a one-time use. The media has a great way of playing on our mental health. I did not create a poll for this, so you can just put in the chat, how many of you had to limited your social media during this time? I found myself, I had to take a social media break. There was just too much information coming in. If you'll go to the next one. So we have events that the media that is impacting our mental health. And then you have, on top of that, life hasn't stopped. So you have personal things in your personal life that are impacting your mental health. I stopped getting hugs. I became a teacher at home. I'm not a teacher by trade. That's not what I do. And homeschooling is very different than teaching virtually, right? So in thinking about our kids' well-being and their mental health, what's happening, the world just shut down, and how does that impact us personally? Our outlets, what we normally do for stress relief, could have, and for many have changed, which leads to a lot of isolation. And then you hear of people taking their own lives. You hear people just not doing well, right? And how this is new to everyone. So COVID kind of put us on a level play, everybody on the same field for one moment, if you will. So you have all of these different factors that are coming in and playing, I shouldn't say playing, but impacting mental health. So what do we do? Where did we go? So the next, if you'll go to the next slide. So you have the next big impetus, if you will. So in March, we have COVID, and then in May, we have where these two worlds collide, two pandemics collide. You have one, the public health, medical, if you will, and COVID exposed a lot of things. And then, so that's a new one. We've never lived through a pandemic in our lifetime. And then you have the social injustices, the murder of George Floyd. So you have a new pandemic or new issue and an old issue, and they collide together. And it's almost like the world stopped again. And so with that, wanting to go into and just have a conversation with Libby as well as the rest of you all to see what was the shift. So I'm going to ask Libby a few questions, if that's okay. So Libby, coming up on May 2020 and the murder of George Floyd, what was the shift for you personally and the shift that happened for PFCC Partners in the PFA network?
Thanks, Naomi, and thanks for walking us through. This is why we all have struggled a little bit, right? And this is why everyone has struggled, because you can see those images and they evoke something in each of us, whatever that might be, based in your lived experience in the world. And all of those are valid. For me, all of those responses are valid. All of those heaviness is valid. For me, it was a shift in my thinking about, I was trying so hard through COVID and through the pandemic to support our community. We started coffee chats so that nobody would feel isolated. We were constantly trying to respond. And at that point, I was like, wow, we've got nothing left. We've got nothing left to do. I can't impact anything. I was feeling so futile. And then I really started to think about race relations in our country and my relationship to race relations and my lived experience living in a what once was the most culturally diverse city in America, and growing up in that avenue, and where we were today. You all know that this work is deeply personal for me. So our partners, our professional partners, they all know that this is deeply personal work to me. And setting up PFCC Partners, diversity and inclusion were right there, founding principles. And so the shift in my thinking was really examining, how do our activities line up with those values? What are we doing to live those values out? And it was a shift in my thinking to say, yeah, we've been inclusive to everybody who comes to our door. We haven't created very many doors, and they're not in diverse places, and they're not in places where people who don't usually get to be part of patient family advisory efforts are existing. And so what were we really doing? And how much did I really understand? So we really looked at those, I really looked at our key values and did some days of very difficult and painful self-reflection to say, yeah, those are words on a page right now, and we just need to bring life back to them. So that started my shift in thinking, and then if you want to go to the next slide, Lindsay, we'll work through some of the activities, because I think, as a helper, first thing I wanted to do was let's go into action, because action makes me feel better. First of all, number one, it's not about me, and what makes me feel better, right? So I had to really kind of slow down, and so like a lot of organizations that were outraged at what was going on this time last year, Memorial Day weekend last year, we put out a statement of support for communities of color, and I immediately got back from one of our board members, "You sound completely tone deaf." And I was really kind of insulted, and I was thinking, I was trying to do the right thing. I'm trying to do good, best of intentions, and kept just saying, okay, what do I need to learn? What do I need to learn? And I have to tell you, I read that statement now, and ooh, it's cringeworthy. But it was a start. It was a start that started a conversation to say, you're not getting this right. So what do I need to do to learn more? So then I went to writing individual letters to every member of the PFA network who represented the Black and African American communities. And they were very humble letters where I expressed my own concern for their well-being, their families' well-being, my apologies for all that they'd been through, and my acknowledgement of white privilege. And I asked them to join me in a work group to help us as an organization change the way we do things to really live out our values. And I got a lot of responses back, and some of them were very rightly so. This is a great token effort, but I'm not interested in token efforts. There was a response of, it's not my responsibility to teach you. Totally valid. All those things were really valid. And I also had these 10 individuals who said, yes, we'll come together with you, and we'll work through this with you, and we'll start a diversity, equity, and inclusion work group. So we had the first meeting, and boy, that was humbling, hard. I think it was hard for everybody, but Naomi will share her reflections as well in just a minute. But the thing I learned most was that people needed to be heard, and I needed to listen. And so we really, really started there, and we said, if you need to be heard, what's the biggest stage we can give you? And so we had the DEI work group members organized a Brave Space conversation that opened our 10th annual PFCC conference in September for about 220 people live on live Zoom, I guess you could call it. And it was a phenomenal presentation, awareness building event. It was at the right time when people were really interested in learning new and different ways to look at race in this country. And we had 11 pages of chat, people saying, I never thought of it that way. Other people saying, oh, thank goodness you're telling my life story. Other people, and so it was a really strong turning point for us. So as a group, we started with an environmental scan. The DEI work group members collated information, documentaries, articles, research studies, a wonderful compilation into a large, really toolkit for equity. And so that's still available on our website as well. They challenged us to diversify our advisory boards, so we did. They challenged us further to diversify our staff, so we did. They challenged us to take an implicit bias test, that all of our staff should take implicit bias tests, and we did. And then they joined us. They took the implicit bias test, and we rolled that out to the network overall. We moved into a DEI assessment, which the group worked really hard on it, compiling from other sources as well, and looked at what are the attitudes and what does our PFA network look like? We're at over 800 patient and family advisors in the network now. What does that look like? And so we did the assessment to understand, and what was really evident was we weren't meeting our diversity and inclusion goals, much as I had surmised when I really started looking at that. And so how can we then move that forward more broadly? The group developed a set of objectives and key results to drive our work together for this coming year. Beyond the work group, we've had external collaborations. So other groups have wanted to host the Brave Space conversation. So this group has gone out and done that in other agencies. And I think really importantly, it's changed the way we do our core work at PFCC Partners. We, as you know, contract and partner with many different federal quality improvement organizations and research teams, measure developers, health systems. And through all of that, we are now able to bring a different level of awareness to the needs and really integrate patient-family engagement for equity. And so I just wanted to kind of share our evolution in terms of the activities. I think you can go to the next slide, Lindsay. So I wanted to share the vision for the DEI work group, which was created together with the DEI work group members. And I'm going to call out that last statement. We'll achieve these aims by transforming the experience of the Black community in the health system to improve health, wellness, and outcomes. And that has been a topic of conversation for this group and even for the broader group since we started, because why are we focusing on the Black community solely when there are so many groups that are experiencing marginalized outcomes in the health system? And so at this point, and I'm sharing our evolution as transparency, I am not saying that we got it right. I'm just saying this is what we did. And if it helps spur other people to think about how they might support their communities, then great. I'm sharing a little bit of our struggle has been around this issue. But what I came to understand from this group is that if we can implement some change and drive some change for the Black community, we will lift all communities in America. And so, yeah, I just, that was definitely has been one of the messy points. And I will just say, all of this work has been messy, and supporting my own mental health and well-being, my team's mental health and well-being, our community's mental health and well-being. It's been messy this year. It's been very, very messy. So with that, I just want to ask Naomi, I shared a little bit of some of my highs and lows. As we've gone through this year together, it's been a crazy journey and there's been lots of holy moly moments. But what are some of the highs and lows that stand out to you?
Some of the highs have been connecting with a group of people across the country, that not people that don't only look like me, that look like me, but not only me, but we're coming together collectively and working together to make it better for the country, right? So that's been a really nice high, and getting different perspectives and being in other people's living rooms or offices, if you will. Connecting, being able to have open, honest, transparent conversations, being able to learn. There's you never know it all. And hearing from others, learning about different experiences. And a high has really been growing. I think about where I was when I got your email, as far as participating. And in reading it, I felt the authenticity. And that's one of the things that really got me, and I've shared before. There's one thing about saying something to say it, And then there's something about saying it and meaning it. And you and team working to jump in and create a space and do the work. And it's been messy. So just know, but that's not a bad thing. For those who don't know, I have a child who is completely dependent. And so we live in a world of uncomfortable, but I've become comfortable in that uncomfortable. But you grow through being uncomfortable. And so some of the lows I would say is sometimes not moving as fast as I want to move. You know, be in having conversations and being misunderstood or misunderstanding someone else, and learning to that give and take, push and pull. There have been more highs than lows, but no, there have been some lows.
Yeah, yeah. I so feel you on the pace. You know, I feel such a sense of urgency. I think we all feel such a sense of urgency now that we should have felt, but I can't go to that place at the moment. But we feel a sense of urgency now. And I mentioned I'm a person of action, so I wanted to act and I wanted to change it and I wanted to fix it. And I also, if I'm being honest, wanted to get out of the place where I was feeling really uncomfortable, where I was really understanding what white privilege meant, and that I wanted to move out of that space because it didn't feel great. And I think that the willingness to listen and really take that time, it's hard. I think that's really hard. It's hard to hear the stories. It's hard to see that reality. Lindsay and I were talking about this the other day. You know, now that we've heard the stories and seen the reality, you can't unsee it. And it's a good thing. But at the same time, it's a difficult thing. So that pace, that challenges me a lot. I think some of the highs, and you know, we got some questions in the registration about, you know, sort of how do we deal with some of the post-pandemic anxiety. I think some of the highs is the level of connection, and that's been within the DEI work, but it's been within the PFA network. In terms of just simply opening a Zoom meeting and having a coffee chat and letting people come and connect so that they're not alone and they're not feeling alone. I think that's, you know, removing isolation and starting to check your own, you know, we started this session today with an awareness of your own mental health. Where are you yourself, right? That old adage, you can't save somebody else if you're not well enough to do so yourself. I don't know how many of you learned that lesson again this year, but I sure did. And so I think just recognizing that there is a common human stress right now that or a trauma that we've all endured to one extent or another, and sort of lose that tendency to evaluate, stratify who's more stressed than you, why should you, how validated are you to be stressed versus you to be stressed. Let's just lose all that and really kind of create those connections. So that for me has been the highest high, and connecting with people across the country that don't look like me, don't live like me, don't think like me, don't have the same faith I do. It's really liberating. You know, if you can just lean into it, it's very liberating. So for me, that's been a little bit of the highs and lows. Yeah.
Can I just say when you said if you just lean into it, and that sounds scary, I think sometimes, and it can be uncomfortable, but you can, not just you, but I'm saying for the group, if you just lean it just a little bit and breathe through it, and then you can kind of back out, you know, but knowing where you are. So thank you for that.
Absolutely. Absolutely. So I think in terms of looking forward, and we want to leave lots of time for conversation because I really want to hear what others have experienced this year and how you're kind of moving through and helping your organizations and communities to move through. But looking forward, if we go to the next slide, I think, you know, how do we come out of this? And again, some of the questions we came in that came into the registrations were really about that. How do we come out of this? I think we have a great opportunity in front of us in terms of really reaching people that are hurting, creating resources that, as Naomi has taught us, are agnostic to any community, whether that be the Black and African American community, the Asian Pacific Islander community, the disabilities community, the any community that is feeling marginalized. I think we can start to create tools together to help people have those conversations and start those sticky conversations that are not easy. And so I think that for us in the coming year and how we come out of it, I think that'll be our contribution to, you know, how can all of these great questions, how can PFACs help to improve access to mental health services for vulnerable populations? Raising awareness, conversation starters, having those conversations. Who's not here? Who's not represented? And who's, you know, suffering? And so kind of working to develop some of those resources and then really sharing broadly with the community. I'm really proud of the PFA network and the community members we have there and their dedication to being disseminators and working with our healthcare partners and to really start to recover. You know, we are all in this together, and if we can lean in to our common humanity to help one another move forward, I think that's really where our biggest potential is for our next steps. So with that, I would love to just open it up. I don't know if we're getting questions in the chat, Lindsay, or if people would like to raise their hand and come off mute.
No questions in the chat yet. Just about the pronouns, if we wanted to talk about that a little bit. I was asked why I put my pronouns she, her on my Zoom name, and I've actually learned from one of our PFA network advisory board members who identifies as they, them, that putting your own pronouns makes it normal for others to put their own pronouns, whatever you want to be referred to as, so it doesn't cause any confusion for anyone else when you're having conversations. So that's why I put mine. But any other questions for Naomi and Libby? Or Naomi, did you want to add something else or comments?
I was just going to say, so that's a great question. And I remember being part of one of the coffee chats, and we had a very lengthy conversation and support for someone who, I'm going to say, got the pronouns wrong, which is not right. They referred to somebody as how they don't see themselves, and the person got mad. And so these conversations, it's about being able to have conversation about, I don't know a whole lot about the LGBTQ plus community, but to be able to open up and learn, to hear, to listen. I think you said in the chat, you have 2 ears, 1 mouth for a reason. So let me listen and hear, and being able, that doesn't mean I have to agree with it or disagree with it. It's me learning. And so just going back to what the vision is for the DEI work group, and that last sentence, and the angst, because we had angst going through this vision. It wasn't like, and everybody wasn't in agreement. So let me just clarify that. Everybody who is brown or Black African American don't always, just like everybody else, not, you know, so you have to go through. But we did feel, if we address things in the African American community, agnostic toolkits can be created. So things that are created from there can be transferred and used into the LGBTQ plus community, can be used in Asian Pacific Islander. Forgive me if I get it wrong, please. And that's what this is about, conversation in the disability community. So just wanted to throw that in there because it fits.
It does. It does.
Absolutely.
So go ahead.
Oh, I was just going to say we have a question from Susan, who says, I am vaccinated. How can I feel comfortable leaving the house and going back into society?
Susan, I think that's a great question that a lot of people are experiencing. Yeah, I would open it up to the everybody who's on to offer suggestions. But what I would say, I know that I felt very much the same way. So take it at your pace. You know, if going around the block is what feels good to you first, then do that a couple of days first. And, you know, we don't have to dive into a large scene, but go
Well,
ahead, Susan.
this week is my grandson's graduation.
Oh,
And last year was my granddaughter's graduation, which of course there wasn't any.
right.
So we're going to my grandson's graduation, but afterwards, my son wants to take everybody, you know, for brunch.
Mm-hmm.
And then later in the day, he's going to have a barbecue at his house. Now, I'm going to the graduation with my mask. I'm not comfortable going to the brunch, even though I just want to go so bad. And I will go to his house later, even though he's having other people, because I'll have my mask on.
Mm-hmm.
I'm beating myself up as far as, you know, when am I going to feel comfortable? When am I going to be able to do these things? Even going to a store, you know, I still find myself running through the store and leaving as quickly as I can. So, or sometimes just letting my husband stand online so I can go back into the car to my safe spot.
Yeah.
So yeah, I don't know. I don't know what to do. I don't know.
Yeah. Well, I think, you know, you have to be, show yourself grace and give yourself some time, but also maybe connecting with others. Are you connecting with others, you know, virtually or?
I am. You know, I'm a volunteer for 2 different organizations through Dignity Health. So we have, you know, Zoom meetings. We're going to start meeting in person, which I'm not sure if I'm comfortable doing that, although I know everyone in that meeting will be vaccinated, so that makes me feel better.
Yeah.
But I'll still have my mask on. So I don't know. You know, all along we've followed the science. You know, we've watched the news. We followed the science. We've felt good about it. And then when, you know, the CDC just announced, you know, no masks for anybody. I think they dropped the ball on that. But I know people personally who did not get their vaccine, but of course, you know, they're not going to wear their mask.
Yeah.
And so I'm very leery about going next to people who I don't know personally.
Yeah.
So I just.
It feels like a really abrupt shift.
It does.
Mm-hmm.
It does.
Yeah. Yeah.
Can I just share so thank you for saying that, Susan, because that is the other side of this that I don't think has gotten attention is we've been enclosed for so long. So how do you feel comfortable going back out? For those who've been in, let me say it that way. And so as Libby said, give yourself grace, give yourself permission to feel how you feel, breathe. And I love you've already worked through the situation that you shared in going to the graduation, skipping the brunch, and then going to the home. So, you know, baby steps. I found myself I've gotten vaccinated. I found myself in the store the other day, and it's like, oh, let me grab my mask. It's like my security blanket until I feel comfortable without it, and that's my choice.
Oh, of course, yeah. And we have 2 grandchildren that are too young to get the vaccine. They're under 12, and they're very involved in activities. So I'm a little leery as well You know, all my other grandchildren, they're all vaccinated, and my children are vaccinated. But I just find myself when I'm near the two little ones, you know, constantly making sure my mask is secure. And I know apparently they're saying you can be around younger ones, although I've never seen anything that said otherwise, but they can be carriers, and it's just so much going on. And
Yeah,
family dynamics have changed.
sure. Well, everybody has an opinion, I think, and that sometimes gets difficult. I think what you're bringing up, Susan, is, you know, just exactly what we've been talking about, which is that everybody's experiencing this and everybody's experiencing it differently. And I think as we come to a close on Mental Health Awareness Month, awareness is making room for these conversations and acknowledging that somebody else may feel differently about it, and creating space where we're coming together and really supporting differing perspectives. I think that's kind of our path forward, but I'd love to hear from others as well. And maybe some of our health system partners that are on the line. I know there was a question about sort of how they're bringing and welcoming families back to campuses. Is there other insights you'd like to share?
If not, I have something to share. This is Sherry Binns in Rhode Island. We have a large number of people in our communities, as people are getting vaccinated, that it appears may not have mounted a good vaccine response and may still be susceptible because of chemotherapy or other underlying health conditions or medications. And some of you that know me know that I have a daughter that is a pastor, and she has her church has just given them permission to start opening for worship services in person, and her response is, yes, we will, but we will continue to distance and we will continue to worship outdoors as wherever possible. And because there are members of our community who are too young to be vaccinated, or for some reason or another may not have responded to the vaccine, in solidarity, we will all be masked when we gather. Mm-hmm. So, you know, I just think that's something that has fallen off the radar of the general populace. And I think the more we can put that back on the radar, and the more that we can love our fellow humans by protecting them in that way, the safer we're going to be in the long run.
Thank you, Sherry. I appreciate that. And for Susan and for others, I see a lot of great ideas floating through the chat box. Fantastic.
And so, Libby, before we move on, there was one more quite large question that I'm trying to get to.
Oh, I'm sorry.
For both of you. No, I was trying to find it in the chat. How are we going to be using this forum to help craft policy for CMS?
It's a great question. So I think for our organization and the way that we will attempt that sort of influence or impact will be to continue to work through the federal quality improvement projects that we have been working on, the hospital quality improvement contract with Cynosure, the quality improvement organizations with Comagin, and raise and elevate the voice of the patient and the family and the people in a much more diverse way than we have been, to bring those perspectives forward and inform all of our partners, CMS, to hospital leaders, to health system leaders, to community members. We're doing a facilitating an affinity group around building effective community partnerships. I think those kinds of efforts, we just got off a call with Illinois Hospital Association, who is doing a tremendous amount of work around changing policy. And so I think it's about you know, sort of raising our own awareness and then partnering with people to tell the story of what's needed. So those are the directions that our organization will be headed and is heading in 2021.
I would just add, if they were looking at what you're going to do for your own, not PFCC partners, I'm talking to the group, for your group, and looking at connecting with your community, and having, so one of the things that we've talked about within the work group is not wanting just one person of color at the table, because one person doesn't speak for the whole. And so being able to look at not only policy, but you have to look at policy and people, and how those go together, and through the work group, looking at putting together toolkits or training videos. It's not just about changing the policy. Policy is important, but being able to see how it impacts everyone and how it's interpreted.
Kay, did you have a comment?
Yeah, I'm the one who asked that question.
Mm-hmm.
I'm the person who goes to all of these meetings and says, you know, there's always a patient at the end of the policy. And,
right.
you know, you sit there and you listen to all these people who have a lot of letters after their names and they want to do this and they want to do that, but there's a patient at the end of every policy. The thing that I'm most interested in is inculcating equitable access to every aspect of treatment. And because this is specifically the area for behavioral health and mental health,
right.
That in particular, because that's been given very short shrift, unfortunately.
Mm-hmm.
But we need to be able to craft all of this into going to these high-level board meetings and legislative level convocations to say, we need these policies because there are patients who are going without.
I appreciate your passion and the fact that you're raising that light and that perspective in every room you're going into. And I think when we have, you know, for lack of a better word or the best word, when we have those kinds of allies in those rooms, I think that you can be those connectors to create the patient and the community voice to inform those rooms. Because I agree with you, we're going to have to change policy, we have to change payment systems, we have to, you know, acknowledge the mental health system as a part of the health system and not just an ancillary, you know, so we've got a lot of work to do for sure.
Because one of the things that I have run into with my community and family background and being an advocate for various members of my circle,
mm-hmm.
Is you can theoretically have coverage, insurance coverage, even with
right.
the ACA, you can have coverage. But if you can't actually get seen, that's useless. And
right.
what's happening is the larger entities which are buying up practices, buying up provider practices and provider venues are saying, well, if it's not this particular type of insurance or that particular type of insurance, you can have a policy. It can be the exact same policy, but this is an individual policy as opposed to being provided by your employer.
Okay.
We won't take it.
Mm-hmm.
So you can have theoretical equity without any access.
Right.
That's
right.
what I'm really here about.
Got it. Got it. Well, I agree with you.
That
go ahead.
is huge, Gay, and that is a huge conversation. I think to continue, one of the things that I say, I'm fighting what I'm living. I'm fighting through what I'm living through. And so one of the things that you said at the very beginning is you being in the room with people with all these letters behind your name. And so being able to be in a space where, regardless of the letters behind your name, you're seen just as, your voice is just as important as all those letters behind someone else's name.
Yeah, because I'm nobody, I'm nothing.
But you are.
That's not true.
And right, but you are. And it matters because the questions that they're trying to answer, they need you, they need us to get to that. It's not the way. So this again goes to conversation, being willing to be uncomfortable. That makes people uncomfortable when you go into a space that's not answering that question right then. And so I just continue asking that question, because if they answer your question, they will help solve their problem and create equity.
Because I have no trouble saying, excuse me, Mr. Emperor, you have no clothes on. Yeah, and the other thing, again, vis-a-vis, forgive me for making a second point, taking more time, but vis-a-vis particularly the behavioral and mental health aspects of all of this. It needs to be integrated into the larger scope of total healthcare.
Absolutely.
What winds up happening at some of these places that I've been volunteering, and I won't get into how I wound up in these rooms. It was totally chance, but I took advantage of it because I got invited by accident, and I haven't let go. But you have people sitting there, and you're like, this one's a cardiologist, and that one's a rheumatologist, and this one's a thisologist, and that one's a thatologist. And I finally get so tired of it, and I said, look, we're not a bunch of giblets. We're whole chickens. And I'm now known as the chicken lady. And when I go to some of these things at the state legislature, some of these people who are making these, doing this legislation, making these policies, they see me coming, and it's like a bad sitcom. They dive into the men's room when they see me coming. I kid you not. They don't get it that one of these days I'm going to dive in after them.
Thank you.
This has to be dealt with. And
I don't think
I don't know how to deal with it other than the way I'm trying to.
So, Gay, I love your passion and the way that you're going. And I think that if what I hear you sort of that may be a benefit to you is to come within a larger community of patient family partners and, find some strategies that have been effective in other areas and bring those to your area of passion. And so, I think that I try to always assume good intent, and maybe that's naive. Lots of people criticize me for being naive or Pollyanna, and that's okay. I'm good with that. What was that?
I get that a lot too.
Yeah, so I'm good with that. But I assume good intent. I assume that people went into healthcare because they really care about people and they really do want to take care of people. I think that people who are in policy areas sometimes are a bit removed from kind of the front lines, and that's why we connect them with patient and family voice. So I applaud your passion and would encourage you to kind of connect with others and see, see what you can learn, see what might be effective. So I do need, we're at the top of the hour. So I just wanted to, no, I'm happy to have you speak up, Gay, really am, and invite you into the PFA network. So some things that we felt were important that people can do, share support group resources for people that are suffering and feeling marginalized. The power of togetherness and belongingness, I think, is a great anecdote for a lot of the stress that people are feeling. Offer a moment of silence and being ready, as we did at the top of the hour, to just sort of sit quietly for a moment. Sit and listen. I have to just sit on my hands and my feet and not try to fix things and just listen. And that's a struggle sometimes. Identify the mental health services in your area so that you can utilize them, you can share them with your families, and you can share them with your neighbors and community. And create respite rooms. I love that. Naomi, what do you mean by that?
So respite room, thinking of healthcare, hospitals or the such, but being able to create a space for staff to just go and decompress. Some people may call them mental health pods, but just a space where I can step away, I can color, I can take a deep breath, I can eat my lunch in quiet. So that's And even at home, creating a space, like I'm on my back porch, creating a space that you can just breathe. We did have an exercise. I know we are over the hour. I'd like to offer, if you want to stay and just do a quick 2-minute, it probably won't be that long, exercise with us, please stay. And if not, thank you for being with us today and being a part of the conversation. Give yourself grace and permission to sit with what you heard and feel what you feel. No judgment. So lastly, I'd like for us to do a quick exercise. If nothing else, when life is feeling out of control, the one thing that you usually can control is your breath. So what I'd like us to do, I invite you to close your eyes. If you choose not to, that is perfectly fine. I want you to imagine a box, a square box. So we're going to build a box. So what we're going to do is inhale for over 4 seconds. We're going to hold it for 4 seconds. Exhale for 4 seconds, and then hold it. So I'm just telling you what we're going to do, and then we're going to do it together. So we're going to go ahead and take a nice deep inhale over 4 seconds. 2, 1. Hold it for 4 seconds. And if you can't hold it that long, that's okay. Do it at your own pace. And then exhale. And we're going to do it again. Inhale over 4. 4. Holding it for 4. 3, 2, 1. Exhale for 4. 3, 2, 1. Holding for 4. 3, 2, 1. Inhale again over 4. Holding for 4. And exhale over 6. 5, 4, 3, 2, 1. I invite you to open your eyes again. Inhale, please. Breathe regularly. But thank you for allowing me to do that exercise with you. When life is going insane, remember to check on you first and foremost. Take a few deep breaths and share this with others. You all have a wonderful long weekend. Libby?
Thank you so much to everybody for joining us today and the open conversation. Have a fantastic weekend, get some rest, and enjoy.